Got big prostate cancer news this morning. On August 3, 2026, a few days ago, on July 31, 2026, the Food and Drug Administration, the FDA, approved Pluvicto, otherwise known as lutetium-177, for the treatment of hormone-sensitive prostate cancer. Got my good friend Bob to thank for alerting me to this just last evening. Now, what is hormone-sensitive prostate cancer? It is cancer that has not yet responded or been treated with castration. That is either hormone castration, chemical castration, or physical castration. Most prefer the former, but you can take the latter if you want. Prior to this moment, Pluvicto was only approved in the United States if one's cancer, prostate cancer, became castration resistant. You don't have to be castrated anymore. This should be good news for fans of the testicle everywhere. Let's take a preliminary look.
What is this stuff, Pluvicto? It is the pharmaceutical company Novartis' trade name for the substance lutetium, which is a radioactive atom that attaches hopefully to cancer cells and kills hopefully cancer cells and nothing else. What's that 177? That's the atomic mass of this atom, 71 protons plus 106 neutrons equals 177. Now, parenthetically, sometimes in this fascinating, scintillating discussion, you'll see a reference to lutetium-617. The lutetium-617 is the molecule that attaches to or identifies a prostate cancer cell. 177 is a radioactive molecule. Now, it's an unstable molecule, that 177, because the protons and neutrons don't add up. If it's radioactive, it decays, creates radioactivity as it decays, and kills those cancer cells. Let's add another word to our vocabulary. Diagnostic. Thera for therapy, and gnostic for diagnostic. That 617 molecule diagnoses, that is, finds cancer cells. The 177 molecule provides therapy by hopefully killing the cancer cells. It is the first of this style treatment that the Food and Drug Administration in the United States has approved for the treatment of prostate cancer. This is essentially how it works. That 177 molecule finds the protein, the prostate-specific membrane antigen protein on the outside of the prostate cancer cells, attaches to it, and hopefully kills it. The substance has been before the Food and Drug Administration in the United States for a number of years. The FDA first approved Pluvicto in 2022, essentially a last chance treatment for patients who undergone everything, including surgery, radiation, hormone therapy, and chemotherapy. In 2025, the FDA removed chemotherapy as a prerequisite. And finally, as of a few days ago, July 31, 2026, the FDA removed hormone treatment or chemical castration as a prerequisite for undergoing Pluvicto treatment. Here's the FDA's announcement that androgen pathway modulation for naive or sensitive prostate cancer, that is, hormone-sensitive prostate cancer, you haven't yet undergone chemical castration. But here's the kicker. It's to be used in combination with androgen receptor pathway inhibitors, ARPI therapy. Well, let's talk a little bit about that. Recall from some of my prior conversations this thrilling concept called androgen deprivation therapy, otherwise known as, yes, chemical castration in the medical literature, which is a more polite alternative to physical castration. Androgen deprivation therapy, a shot of a hormone, oftentimes one called Lupron, simply prevents the body from producing testosterone. Prostate cancer cells love testosterone. They can't thrive for very, very long without it. In fact, they'll stop growing. But these things are not only nasty, but they're smart. They will mutate after between a year and 2 years, mutate sufficiently they no longer need testosterone to grow, thrive, and kill you. ARPI is slightly different. It attaches to the cancer cell's receptors for testosterone and blocks the testosterone reaching those cells, signaling them to stop growing. So it's a more polite version of hormone therapy. It still has some side effects, maybe not the intimate side effects of androgen deprivation therapy, that is chemical castration, but at least for me, one of the most significant ones is how can I be an obsessive, insane cyclist if I'm on this stuff? Okay, at least in the United States, no Pluvicto for me, unless I simultaneously undergo ARPI treatment. But wait, we can roll the clock back almost precisely a year and find a study that demonstrates that ARPI doesn't provide additional benefits over Pluvicto. Adding the ARPI did not improve response rates nor overall survival rate compared with only Pluvicto. What's going on here? Okay, let's give the FDA a break. There are lots of studies going on, some of them a little ahead of others in stage 4, some of them are in stage 2, what have you. The FDA is doing its best to assemble the information and provide the best opportunities it can for patients in the United States, right? Well, let's go back a few years earlier to 2022, and a study that revealed that patients who did not undergo hormone therapy got better results from lutetium than patients who had undergone hormone therapy. What's the explanation? We already know this. Prostate cancer cells are smart and nasty. They mutate. And once they've mutated, they are harder to kill. Let's take a look at an anecdote. Back in 2025, now our favorite year. This is a report of one data point, but a patient who refused both surgery and or hormone therapy got lutetium treatment and had a significant result, both in shrinking his tumor and in eliminating or reducing any other indicia of cancer. What's on my horizon? Well, hopefully I can look just over the horizon of current medical treatment and jump onto that slowly moving train that's starting to recognize that this radioisotope is a better form of treatment than other alternatives, including in the absence of any kind of hormonal intervention. Here's a study looking to preserve the quality of life by delaying treatment with androgen deprivation therapy. The study began in 2024. The study itself will end in 2028. Analysis of the data will take another 3 years. This is for oligometastatic prostate cancer. We're adding again to our vocabulary. What the hell is that? That means you have 5 or fewer lesions. What about Europe? Well, Europe is about where the FDA is now. For some time, the official position in Europe has been that patients are eligible for lutetium-177 treatment only in conjunction with ARPI therapy. There are clinical trials in Europe. Most of them are ahead of the clinical trials in the U.S., and they are looking at this question that I'm asking: how about using this radioisotope for hormone-sensitive patients? And if it's successful, we can postpone the more burdensome hormone therapy. This is a post in a physician's forum, the Mayo Clinic, on June 6th of this year. The article it discusses appeared in The Lancet in April of this year. Lutetium, in that fancy word, oligometastatic hormone-sensitive prostate cancer. In addition to being effective, most treatment-related adverse events were low grade. Exactly what I'm looking for. You can get more effective treatment with fewer negative side effects. So here's to hoping that medical science advances faster than my cancer is advancing. But I can't get to this question until I undergo my prostate-specific membrane antigen positron emission tomography on August 27 of this year, 3 weeks from now. That is my PSMA PET scan. You recall from prior discussions how this works. I get shot up with another radioisotope. It attaches to that PSMA protein on the outside of my prostate cancer cells, which are clearly floating around in my body. And hopefully, when I'm stuck inside this CT scanner, which takes a CT scan and X-ray every half a millimeter in every direction on my body, the physicians can't see where my cancer is. It won't be my prostate, but it could be somewhere else. And hopefully I can get to the place where I question how I get the best treatment. Yeah, it's sort of a curious wish. I'm hoping that the scan finds cancer. I'm hoping that with, like these patients, something lights up on the screen. My oncology team and I know that my cancer has returned. That is, it's always there, but it's gotten back to measurable levels. It is floating around in my bloodstream. It'd be nice that it landed somewhere. We can identify where it is and then nuke it with these fancy radioisotopes. Oh, and what about the expense? Well, it's not cheap. The lutetium costs about $50,000 per injection. You get one every week for 6 weeks, $300,000. Oh, but I've got universal health care. I'm an old person in the United States. I got Medicare. Well, with Medicare Part A, if I stayed overnight in the hospital, the federal government's health care plan, for which I paid my entire life, would cover the whole thing. Oh, but this is an outpatient procedure. Part B applies. It only covers 80%. So, wow, what a cool thing. Only $60,000 if I can get this treatment. So, yeah, maybe I'm looking east towards Europe. We'll see.
That's the news for now. I have my PSMA PET scan that will detect any lumps of cancer big enough to see with the radioisotope that scan uses on August 27, 2026. Until then, fans of the testicle, keep those fingers crossed and rave on.